Hi, I'm Aly. I'm one of the physiotherapists at Banff Sport Medicine, and I see clients for women's pelvic health. So a women's pelvic health physio appointment looks a lot like other types of physio appointments. So we often will look at kind of your general movement in standing, but the one thing that's unique with a women's pelvic health visit is that we actually include an internal assessment, and this helps us to assess the pelvic floor muscles, and then we can see how they work with your other muscles like around your glutes, your core, and then how you're moving through your back and your hips as well. People will come to a pelvic health appointment if they have issues like urinary incontinence, and that can be stress urinary incontinence, which means leaking with an increase in intra-abdominal pressure. So that might be leaking some urine with coughing, sneezing, laughing, jumping, those kinds of things. Or urge urinary incontinence, which will often mean more that you can't make it to the washroom in time. Sometimes you have a lot of frequency with that too, so if you're going to the washroom more than 8 times a day, then that would be considered abnormal. So in physiotherapy, we can help look at the muscle tension, if there's too much, not enough, how you contract and relax the muscles, and how you coordinate it with those types of increases in pressure. Sometimes looking at doing a bladder diary can help as well for those people who have a higher frequency. One of the other things that people will come to pelvic health physio appointments for is pelvic pain. So sometimes if there's an increase in muscle tension, this can cause pain with intercourse or pain with sitting sometimes, some pain around the tailbone, especially if you've had a bad fall on your tailbone. Other things too that can cause pain would be people who have hip pain, low back pain. There's often a component of tension in the pelvic floor that can contribute. So if you're not getting where you want to with your physiotherapist, just working externally on those structures, sometimes it's good to check internally on the pelvic floor to see how those muscles are working as well. Other populations that often will come in for a pelvic health appointment would be pre or postpartum, so while pregnant, preparing for delivery, or returning to activities after pregnancy. And then the other group would be pre or post surgery, so if you're having a pelvic or abdominal surgery, checking in with a pelvic floor physio before or after surgery to optimize recovery can be really helpful too. Another common thing that'll help women with postpartum is pelvic organ prolapse. So this can be any of the organs in the pelvis here. Sometimes can have a small bulge or descent kind of into the vaginal canal. And so working on our pressure management system can help with resolving or preventing worsening of the prolapse. For some people's issues, a standing pelvic floor assessment can be really helpful to see how the pelvic floor muscles react when you're in a gravity position, so how they're lifting and relaxing against gravity, and then how they work with the pelvic floor muscles and the hip muscles when you're doing something like a squat or lifting a weight off of the ground, to look at the timing and coordination. After the assessment is done, you'll usually get some type of homework to work on at home, and this can include maybe purchasing other tools that can help you work on some of these types of things at home, like a pelvic wand as shown in the video here, putting different pressures on the areas of the pelvic floor muscles. And you'll probably get some types of breathing exercises and sometimes other general strengthening exercises that just have you focus on how you're coordinating your breathing, your pelvic floor, and the other hip and core muscles. If you guys have any questions around women's pelvic health, or not sure if you need a pelvic health appointment, if you're the right person for it, or any questions or concerns, really feel free to reach out to Aly at Banff Sport Medicine.